Hi, this is Dr. Nigel, the Bladder Doctor. Today we're going to talk about 3 key things that we need to understand to help improve our bladder function. The first thing that we need to understand is first how our bladder works. Second, we need to know is just a few things that affect the bladder. And then before you leave today, I want to give you at least one great tip that you can start right now to improve your bladder function. So let's take a look at the anatomy first. So I got a balloon here, which is very similar to your bladder, and it's nestled within the pelvis. Inside that pelvis, we have our organ systems, and ladies, we have the uterus that sits on top of that pelvis. And then the outer portion would be the urethra. So to understand the anatomy of the bladder, you've got the balloon, which holds the urine. Up here, we have the kidneys, which come down and drain into the bladder. And then we have the urethra, which has sphincters that close and open the bladder. The big challenge that people consider is they think that urine is held exclusively via the sphincter. And that's a piece of the puzzle. And you've heard a lot of people about pelvic therapy and restoring the function of the muscles within the pelvic bowl. Those are useful. However, they're limited because there's more than just one thing that influences the bladder. So not only do we have the muscles that can be affected from childbirth to trauma to deconditioning, we also have hormones that can affect those tissues and reduce the elasticity, not only in the pelvis, but also of the uterus and of the internal organs that are pressing down on the bladder. So when somebody does pelvic floor therapy, they can get some limited benefit. However, they're missing a couple key factors. Is we have to remember that there's the muscle, there's the nerve, and then there's autonomic and conscious control of the bladder. So when we do Kegel exercises, those are useful. They're helping to improve the connection between the brain and the bladder. However, what people don't understand is over 80% of the valve is actually autonomically controlled. So what that means is 80% is unconscious. So let's think about what classifications we have of urinary incontinence. We have urge incontinence, and we have stress incontinence. If you notice, people with incontinence, the thought of going to the bathroom causes spasm of that ureter. So just the idea that they might be going to the bathroom soon causes that valve to flex back and forth, which can cause leakage. So understanding that it's not just the sphincter, it's not just the muscles of the pelvic bowl that influence the bladder, it's the connection between the brain and the body. So our system is designed to help re-coordinate those. Those other systems out there are fine when they use, let's say, electric stimulating devices that are put intravaginally to help improve the sphincter. They have value, but all of you ladies who may have used those in the past have noticed you hit a wall because it's only hitting 1/3 of the actual bladder effect, which is quite distressing, right? Because we thought, hey, if we can get that bladder strong, then we don't have any problem. But what the missing link is that brain-body connection. That's where a lot of the solution comes in. So one of the biggest tips I want to send you home with today is before you do anything, I would like you at least 3 times a day to close your eyes and breathe. So air in the nose, air out the mouth for 10 breaths. And I encourage you to do that 3 times a day. The reason this is so important is because when we're under the stress response, our body goes into what's called the sympathetic mode. Sympathetic means everything becomes tightened and everything becomes more reflexive. That's also included your bladder. So one of the first steps to gaining control of your bladder is to start doing what's called mindful breathing. I encourage all my patients to start doing at least 3 times a day, 10 breaths. And what you might also consider is just focusing on relaxing down in the lower abdominal area and the perineum. That's right underneath your pubic bone. So 10 breaths, 3 times a day. Start focusing on that, and when you start to see some connection between the stress response and improving bladder function. Thank you. Have a great day.